Yeah, right there.
Did you just yell? Okay. Wouldn't want anybody falling on camera. Off camera, it's no proof. You can use my word versus yours. Oh, freebies. Oh. From this angle.
Oh. Imperfect.
Perfectly imperfect. That's perfectly imperfect. That's the whole motto of business. For any entrepreneurs out there, consistency beats perfection every time. I'm kind of curious how you drove here. Were you able to check your blind spot okay?
Yeah.
Okay, good. That's probably from doing a big old thoracic twist. Kat, thanks for coming in today. Much appreciated. I was first met Kat at one of her more recent, I guess it's a musical, right? That's what it was?
Yeah.
It was Jesus Christ Superstar. And I think, are you okay sharing a little bit about what went down with that? Because that seemed like it was a really interesting take on something that isn't really spun off very often.
Yeah, no, it was, we sang, we danced, we acted. It was a small cast. Typically it's a 20-person cast, but we had a cast of 12, so it was a lot of double casting and a lot of running around and kind of doing a lot of things. And it was just a wild time.
Now, if I recall, you were in the ensemble, which means you were dancing quite a lot. And with that dancing, I think we had a dancer on this channel just last week, that can present a few pains or issues that can arise. Now, what are you in for today exactly? What is that's bothering you?
Yeah, my lower back.
Okay.
I also kinked my neck a couple days ago.
Lovely timing. Yeah, that's for sure. Yeah. So the lower back and the neck. Let's start with the lower back. Okay, how long has that been bothering you for? Have you seen anybody for it before?
Honestly, probably since the show.
Since the show. There we go. Okay, there we go.
Yeah, so I've just been doing a lot of rejigging myself, but definitely time to.
Is this the first time that you've had lower back discomforts, or has it been a reoccurring issue in your life?
I think it's just since that show.
Really? Okay, yeah. Wow, okay, so she was dancing vigorously, and that's good. We like that kind of activity. We encourage that kind of activity. Obviously, sometimes we need a little bit of a tweaking, right? And then the neck. Tell us about that. When did that start? What were you doing? Did you just wake up with it?
I woke up with it. Yeah. So it was. I think I just slept a weird way, and it's just been kind of kinked since then.
Yeah, there comes a point in all of our lives where we can actually sleep wrong, which is just it's a sad point once we get there. I'm there as well. Okay, so you got some neck issues. You got some lower back stuff that likely came on from a sudden increase in activity, right? I assume that the training and the rehearsing for these shows is rather vigorous, right? And were you doing any kind of dancing pretty regularly beforehand, or was this a huge spike in sudden activity?
Yeah, well, we were rehearsing up to 3 times a week, and then the rehearsals started to increase to daily.
Yeah,
so
okay, that's
it slowly increased, but it definitely was we were on for 3 hours.
So even when you are familiar with the different kind of exercise or activity you're going to do, doing things daily that are that vigorous can sometimes lead to some mild degree of risk, okay? The body needs to recover, it needs to heal. That's why we need to be able to sleep. That's why we need to eat good food. But of course, it's showtime. So if you put that secondary, you get the job done, and then once the job is done, you can fix the things up afterwards. So
right.
Happy you're here. Have you seen either a chiropractor? Well, have you seen a chiropractor before?
No, never.
No? Okay, so that's exciting too. Have you seen a physiotherapist or a massage therapist, osteopath?
Yes,
all
3 of those.
What were those for?
I actually had some shoulder discomfort from, I don't even know how it happened.
That's the best kind, because it's not bothering you anymore, right? Or I hope it's not bothering you.
Yeah, no,
Perfect.
It's pretty good now.
Good.
And then massage therapy just for if my back muscles were sore, just to work some stuff out.
Okay, yeah.
I had a really bad ankle injury about a year and a half ago.
What was that? What happened there?
I rolled it, so it was a pretty bad sprain. So I went to physio for that.
Okay, and that's that. How's that ankle with you now? It's totally strong. It's good.
I still have to keep doing exercises to keep it strong because I definitely notice if I don't do them, then it starts to bother me.
Do you get pains, or do you feel like you get unstable on it?
I think I just get depending on what I'm doing. If I'm dancing or doing something where I have to be on my feet and using my releve, then it hurts more. Okay. So the strength isn't.
Sorry, releve is someone who's unfamiliar, and most of you guys probably watching unfamiliar.
If I'm on the balls of my feet and standing and lifting, or need to hold that and support it if I'm not doing the exercises.
That sounds like it would be painful even with everything in the feet. Maybe for me. But okay, so we got lower back, we got neck, we have a history of ankle issues that seems like they've improved, but you got to obviously maintain those exercises if you want consistent output. You need to get consistent input. Any other complaints, or does that pretty much surmise everything that's going on?
That's pretty much it.
Perfect. Okay. No symptoms down either of the arms or down either of the legs, out of curiosity? I'm talking like any pains or numbness or tingling.
I mean, like my knees bother me sometimes.
Related to the dancing, you think?
Yeah, I think so.
Yeah, that's pretty standard.
Yeah.
All right. If that's the case, then what we'll do today is we will get into the physical exam. Okay. We'll figure out what's actually going on, to the best of my knowledge, and then we will get into the treatment for you. Awesome. Okay. Do you have any questions about that before we get started? Or?
No.
Awesome.
I'm ready.
Let's get into it. All right. So Kat was mentioning that she's got some neck pain. Which side was that you're feeling on, or was it pretty central for you?
It was like on the left.
On the left side more. So are you able to point to it for me where you're feeling it right now?
It was like mostly like near the base, but it would like pinch on this side. It would
pinch there, okay. Yeah. So she's pointing to her C7T1 area. You guys are probably pretty familiar with that, but we'll throw up a picture of it anyway so y'all can see. But right in that area is where you're feeling it the most. Let's do a range of motion now. Get you to rotate your head as far as you can to the left for me, please. So doing this, are you in that pinching as you do this?
Not as much.
Not as much? It's still there a bit?
Yeah.
Okay. So she's only getting about 30 degrees of rotation to the left side. Let's compare that to the right. Rotate as far as you can to the right. So here we're getting to 45. Okay, so there's about a 15-degree asymmetry between those sides. I'm kind of curious how you drove here. Were you able to check your blind spot okay?
Yeah.
Okay, good. That's probably from doing a big old thoracic twist, but all the same, that's interesting to see that asymmetry. I'll get you to bring your left ear down to your left shoulder in a lateral tilt. So again, we get about maybe 20 degrees here, and right ear to right shoulder, please. Yeah, 45, if not 50. So another asymmetry. She's definitely got a lot more freedom moving to the right as compared to moving to the left. Let's bring your chin down to your chest for me, please. All right, now does that provoke any kind of discomfort back here, or what does it feel like?
No, that feels pretty
That
fine.
Feels normal? Okay, now if I do something kind of mean and push it, better, worse, or the same?
Definitely feel it on the left side.
Okay, so you're feeling it there, flexion intolerant. Let's get you to look up towards the ceiling now for me. How's that?
That's fine too.
That's fine. Okay, again, something kind of mean. How's that now?
That's fine.
That's fine too. Good. All right. Give yourself a tight hug. Tight hug. Now rotate as far as you can to the left, please. So we're able to get about 45. Rotate as far as you can to the right, please. You can get to 45. Okay, so the upper back seems like it's okay. We'll get you to drop the arms there. Could you please stand up for me? Now please try to bend down, touch your toes, see if that bothers any of the lower back discomfort. Anything there as you do that?
No.
No? All right. Come back up the other way for me, and I want you to now extend backwards like this. Does that...
Like this?
Yeah. Does that provoke anything back there?
Yeah, I definitely feel it's tight.
So you're feeling tension when we do the extension of the lower back, huh?
Yeah.
Okay, sounds good. We'll get you to have a seat for me again. All right, so Kat's dealing with some lumbar lower back pain that seems like it's provoked when we do that lumbar extension movement or bending backwards. So whenever we get somebody who's getting issues bending backwards like that, the first few diagnoses that come to mind are things like, and don't let these words scare you, okay? I'll walk you through them all, don't stress.
Okay.
I've learned I gotta be careful with the kind of language that I use with the patients in here. Things like facet syndrome, where the joints that actually connect the spine together might be a little bit inflamed, might be a little bit irritated, especially if there's repetitive extension-based movements, which I saw your show. There were many, right? You can't turn it off once you learn this. Things like that. And then also like more, and she doesn't fit the right age range for this, but things like stenosis, things like, what else? They'll come to me as I go forward. But again, given her activity level and given her age group, I'm thinking it'd be something relatively non-serious. Probably looking at those facet irritations. So let's go ahead and screen for any flexion-based issues, namely discs or nerve tension. I'm going to go ahead and bring this leg straight up. Do you get any discomfort in the low back as I do this at all, or not particularly?
No, not particularly.
Okay, now you might get some tension back here.
Yeah, that's right.
Okay, that's actually very normal with this. Yeah. So now I'm going to get you to slowly lower this leg down yourself. Slowly lower. Does that provoke anything in the low back at all?
No.
No? Perfect. Okay. And we'll go ahead and bring this leg up. How's that?
That's fine. I can feel it like a little bit moving around.
In the back there?
Yeah.
Okay. Now I want you to slowly lower this leg down yourself. How's that?
That's okay. No pain.
No pain? Well, you feel like
just kind of like I want to like fix it.
Like, it feels like something's just not moving correctly there.
Yeah.
Huh? Okay. So what I'm going to do next is I'm going to bend this knee. I'm going to place my hand behind your hip here. And I'm actually going to bring this knee up a little higher. I'm going to place the hand behind your hip, and I'm going to push through like that. Does that provoke any of that discomfort you're dealing with, or no?
No.
Awesome. Now let's do that on this side. I'm actually going to come around to do it this way. Again, we're going to bend that knee. Bend, bend, bend. And place the hand behind the hip here. I'm going to push on through. How's that? Oh, what happened there?
Something.
That was almost like, was that in the knee or the back? I felt something shift.
I don't know what it was.
Yeah.
In my knee, maybe.
Okay, but does that provoke your discomfort?
No.
No? Awesome. Okay, good. Let's do a hip.
Might have been my hip, actually.
Might have been your hip that popped in?
Yeah.
Damn, I had the microphone on the wrong side, there. Somebody in the comments requested more hip pops, so I'm sorry I just let you down. We're going to go ahead and we're going to bring this up. And so let's do a hip screening. I'm going to bring you up like so. Let me know if any of these movements provokes that lower back discomfort for you.
No, there's like popping.
I can't feel that popping in the hip as we go around, but it's not repetitive. It's only one. So, okay, that's okay then. That's all okay too?
Yeah, that's fine.
Okay.
Just my hips popping.
All right. So if that's the case, let's next get you. I need you to actually slide down. I want you to sit here and lay back for me. Okay.
Okay. Sit here.
Yeah, sit there and just lay back for me. Okay. Now I'm gonna get you to pull your right knee into your chest for me, if you can. Good. Okay. And now switch. Left knee into your chest. Good. Okay, and you can relax there. So that's a negative Thomas test to you guys who've seen me do that one before. Next up, I think I will get you to lay on your front, okay? Now, Kat, you are dealing with this lower back pain that we talked about. Where exactly is that located? If you can point to it with this arm for me, just because I got the setup on the other side. So you are pointing to right there, yes?
Yeah.
Okay. So she's pointing pretty dead center, all right? She's not off to the side. She's not off in the muscle. She's very dead center. Now, what we have dead center in our spine are our SPs, okay, or spinous processes. They're kind of the spikes that stick out of the back of our spine. When we extend backwards, okay, when we bend backwards like that, what we're doing is we are actually approximating or bringing those spikes, those SPs, closer together. And in some cases, if we repeatedly do that over and over and over again, you can get some pointy or pinchy feeling pain. Does it feel like a pinchy pain when you bend backwards, or what does it feel like?
Yeah, it definitely feels like
Definitely. Okay, all right. So that is possibly what's going on. At the bottom of our spine exists a bone called our sacrum. It's a triangle like this, okay? It connects into our pelvis bones, which are actually referred to as our iliums, creating the sacroiliac joints, which are right here, okay? Now, if I press on through these areas, does that cause any pain or discomfort as I press through these guys, or not really?
A little bit of discomfort.
But that's not the chief complaint. That's not the pain you feel when you dance.
Right,
No, okay. All right. So working our way up the spine, that is again right where you feel it, huh?
Yeah.
Okay.
Yeah.
Now if I do this, what does this feel like? Is this painful at all for you, or does it actually feel kind of relieving?
It feels a little bit like tight.
Tight. Okay, like a stretch out of that.
Yeah.
Okay, good, yeah. So this makes sense because when we're doing something called long axis distraction, or pulling apart, I am trying to spread those SPs away from each other, which should feel good, should feel like a stretch if the issue is that approximation and extension. So, pretty sold on that's what's going on down there. The way that we're going to fix that, actually adjusting is probably one of the main ways of fixing that, which is rare on this channel. Usually I recommend it's going to be like an exercise thing, or it's going to be like a big soft tissue component. In this case, the cracking is actually rather called for. So that's a nice change of pace. If you're a straight shooter chiro in the comments, please don't blast me, because I'm actually on your side for once. Okay, now we're going to creep our way up here. Do you get any upper back discomfort with this neck pain lately, or?
It's been a little bit, like sore.
Okay.
But
well, let's poke through. Up in there, especially? Yeah. Okay, now what about that same area on this side? Not so much?
Not as much as that.
Okay. Oop, freebies. All right, so me feeling through her upper back just caused a spontaneous pop. There's what I'm going to do is I'm going to shut up while I work up here, okay? Just in case we have more accidentals. And of course, no more accidentals, but that's okay. So what I am going to do though is you are really tight up here as well as right here, okay? So I'm going to adjust up here and here just because you're in the right position for it, and then we'll come back to the lumbar spine later, okay? And then we'll also of course do your neck in a bit too. But starting up here, this is going to be your first time being adjusted or cracked then, eh?
Yes.
Ah, that always makes for good content. Okay. So are you nervous at all about it or not particularly?
No, I'm kind of excited.
Oh, yeah, we like excitement. That's really good. So what I'm going to need from you in order to actually make this work is that we have these two really big balloons, okay, in our chest cavity known as our lungs. So we need to make sure that those are empty. So I'm going to ask for you is I'm going to get you to take a really big breath in, and I want you to push all that air out, okay? All of it out. Good.
Oh.
Nice. There you go.
Ooh.
You okay there?
Yeah, okay.
Perfect. So that's Kat's first adjustment. Went very, very nicely. Let's creep up to these areas of more tension here. So I feel something here that I'm going to try for. Take a big breath in once again, all the way out. There's another little one. Good. And then there was also this spot here for you, yes?
Yeah.
Okay, so I'm going to go ahead. I'm going to move the microphone here for all you guys watching. Right there. Okay. Big breath in. All the way out. Okay, that one was very subtle, but it was there. Okay. I'm just going to turn your head here. No, that one's not going, but let's try the other side. Turn your head here. Okay, good. All right. So those weren't too bad, were they? You survived.
It's good.
Good. See, guys, it's not scary. It's just you're just unfamiliar with it. It's fun. So next up, I think what we're going to do is we're going to get you laying on your side. Okay, so Kat is in the position for her low back to be adjusted. I'm actually just going to shift her off her shoulder there so she doesn't get any discomforts. To reiterate, what we found was that her pain is pretty like dead center in the spine. Okay, it's not down by the SIs. It is very much up in the lumbars and it's central. Okay, so to reiterate, you're not getting any numbness or tingling down either of the legs. Are you? Perfect. Okay, so with that area and her issues in extension, we're expecting it to be approximation or closing of those spinous processes. So obviously you want to adjust them to open it all up. Can do. We're going to bring this leg up and we're going to bring your hips towards the edge of the table here. I promise you're not going to fall. Okay? Wouldn't want anybody falling on camera. Off camera, it's no proof. You can use my word versus yours, but on camera especially no. Just keep your arm right there. So what I'm going to do here is, again, I'm going to shut up. I'm going to roll you towards me. You might feel like you're going to fall off the table because you can't see anything up here. But my leg's right here. I promise you no one's actually falling off. You're not going to fall off. So just stay relaxed for me. Exactly. I'll catch you. No problem. All right. So take a big breath in for me. And then all the way out. Good. All the way out. Nice. Okay. Well, one thing worth mentioning at this point to save my ego is you did pop something just getting in a position where the camera was on. But let's try from the other angle here. So I'm going to bring this just like that, and you're going to go right there. Good. Bottom leg straight, top one bent, and we're going to scooch the hips closer to me, please. Thank you. Awesome. So from this position, big breath in, and all the way out. Sink into the table. Good. There was a smaller one there. It was subtle, but the mic would have hopefully picked that one up. You okay?
Yeah.
Can be.
That was good.
Good. I'm happy you think so. It can be a little weird having a total stranger just jump on it, but all the same. I'll get you laying on your back next. So.
Be imperfect.
Perfectly imperfect. That's perfectly imperfect. That's the whole motto of business. For any entrepreneurs out there, consistency beats perfection every time. Okay? So just be consistent with what you're doing. So speaking of consistent, let's, I don't know where I was going with that, but let's take a look at the left side of the neck. So you were saying that your tension was predominantly, and to me it definitely feels like it's lower down in the neck.
Yeah.
Do you get headaches a lot or not particularly?
Not usually.
Okay, good. That makes sense. The upper component, the upper part of her neck feels quite good, actually, which is rare in the people that come into this office. But this upper area is what's most associated with headaches oftentimes. But we're definitely lower down. I'm noticing some base of the neck, paraspinal, or perhaps trapezius tightness right there. All right. So let's work that out with some soft tissue, and then we will get into adjusting that. And for those watching, she did not self-adjust her neck right before this started, so if I can't get it, it's because I'm just bad at my job. Okay, good. So, neck adjustments. This is your first time getting adjusted. How do you feel? You excited right now or you're nervous?
Good, I'm ready.
Ah, she's ready for it. Okay, we got the good preamble. So what I'm going to do is I can get you to rotate your head as far as you can to the right, please. Okay. Good, and then just drop and relax your head in that position right there. Okay, now what I'm going to do is I'm going to come from this angle.
Oh.
And just get it all without giving you much of a time to freak out about it. How was that?
That happened.
That was a lot.
The
mic probably got all of that because there was at least like 4 or 5 things that went there.
Yeah, that was loud. My ears.
Yeah, that was a good one. Anytime somebody gets their neck adjusted, to them it always sounds a lot louder than it actually does to everybody else because it's actually literally inside of you. Okay, you're getting bone conduction happening, which is why it was like, oh, it feels like everything just exploded. Rest assured, it wasn't that loud, but it was a really good release.
Yeah, it was great.
Yeah. All right, now let's take a look at this side. If we get that much on this side, I'll be very, very shocked, but all the same. Right there.
Yeah.
So we're a little higher up on the right side, which is fine. It's a more common area of tension than the base, and the left base is where her primary complaint was, not necessarily the right side. So same concept. You need to rotate as far as you can to the left, please. Good, and then drop that head. Sink as if it's a pillow. Good. Just a little one right there in that area of tension. Perfect. You look kind of happy and content. So
yeah, that was like, I feel like I could take a nap. I don't know.
Yeah, you know what? That is an extremely common thing that people say afterwards. They're like, yeah, I'm just ready to go sleep.
Yeah.
And it's like, it's the rush of endorphins and sympathetic response you get because it is a little scary. But then once it's over, you feel really relaxed.
Yeah.
I'm ready to take a nap. Okay. And I've had it done to me 1,000 times. So, all right, good stuff. Next up, I think I'll get you to sit up for me. All right, so we just got a really, really good release out of Kat's neck here. Like, you were a little shocked, especially on that left side. Everything went, and you said it was quite loud. Now let's follow that up with a little bit of muscle work, okay? The low back isn't really a muscular problem. I just finished explaining to her it's more likely the ligament that exists between the spinous processes, or the interspinous ligament. But up here, definitely likely a muscle tweak of some sort, especially if she just woke up with it randomly. So, to that end, myofascial release technique, we're going to do some muscle work on it. I'm going to start off by getting you to look up and to the left for me, please.
Up and to the left.
Crushed it. Good. Now I'm going to get you to I'm going to take an elbow. I'm going to put it right there. Now if you could please slowly look down and to the left. This might be a little bit uncomfortable. And, down and to the right, excuse me. Apparently I don't know what I'm doing. Okay.
Okay.
Yeah, so how does that feel? And you can be honest. You
definitely
can say that it's
sore.
Yeah, definitely tight. Okay.
Yeah.
You should look up and to the left, and we're just going to repeat that movement. So you can come right back up, and now please slowly down and to the right, and go right ahead.
Ooh.
Ooh.
Yeah, right there.
Did you just yell? Okay. Up and to left, down and to right. Yeah. Wow, my voice can still go quite high. Okay. Nice. And up to left. You guys still need male singers for Hadestown? I'm in. I got the range.
All right.
And up to left, down to right.
No take backs.
Oh, shoot. Okay.
Yeah, that sucks.
That sucks. Okay, good. And up to left, down to right. That sucks. Ignored. Continues doing it. The empathy.
Do what you gotta do.
In this room, exactly. My patients started getting a lot better the moment I stopped caring about whether or not I hurt them in the room. Respect, obviously, within reason. I'm not out here to cause pain, okay? I need you to tilt your left ear to your left shoulder, please. And right ear to right shoulder. Yeah, there is a very, very large canyon between making an omelet by breaking some eggs and medical negligence. There's a huge difference there, so, be smart. Okay, good. And tilt left to left. And now right to right, please, slowly. Ooh. Sound effects. Love them. Left to left.
Start breaking out in song and dance soon.
My chiro really hurts me. I don't know what the next line would be. I'm bad at writing. Okay, left to left. And right to right. Yeah, that's yeah, so I could honestly sit on this all day. Just FYI. Left to left and right to right. And then we'll do the other side too, just to keep you even, why don't we? Nice. Okay. And we'll get you up and to the right next, please.
Up to the right.
Yeah, so
like look.
There you go. Got it. That's okay. Now slowly down into the left. Go ahead. Good. Up to right. Slowly down to left. And up to right. Slowly down to left. Up to right. Slowly down to left. I don't think the mic can pick that up, but there's renovations going on next door. Can you hear that?
Yeah.
I've been here for 2 years, and the renovations have been going on for 2 years. You'd think they would be done.
They just keep picking something different?
I don't know. Maybe it's just different contractors, maybe, but after 2 years and the renos aren't done, I think the place is cursed. Get out, right? Just find a different unit.
Yeah.
Down to left.
This side feels tight too.
Yeah, it probably is. I mean, not many people take the time to really try to loosen these out or get somebody to work on them. I'll get you to tilt right ear to right shoulder, please. And now please slowly left to left. Go ahead. Good. Right to right. Left to left. It's okay to laugh at ourselves. It's healthy.
It's like it shouldn't be hard to do that.
Oh, no. Believe me, it can be. Yeah.
My body's like, don't do that.
Don't worry, I'll help you. Here you go. There you go. That's how we do it. That's how we get mean. Okay, and right to right. We'll do 3 more, okay? Go ahead. Good. Right to right. Left to left. And right to right. Left to left. Good stuff. Awesome. Okay. Lastly, shrug the shoulders off into my hands, and now please slowly lower them down. Slowly lower.
I don't think I can.
Up. You were doing it. You're doing great. Slowly lower. And up. Slowly lower. Oh. Ready to go take a nap?
Yeah.
You can go sit in the chair and take a quick nap. Okay. Kat, how did you find all of that? I think I have an idea of how you did, but how did you find... Well, why don't you tell us what your experience was like?
Yeah, it was great. I wasn't really expecting anything, one way or the other, and I definitely feel like more like movement and like relaxed, I want to have a nap. So. Extremely common, right? What you're saying is the experience for, I'd say, probably like 95% of people, especially after their very first time when there's no expectations. That sleepiness, it is from that sympathetic system, that rush, because what you're doing either hurts a little bit, if it's my sharpened elbows, look at that hook there, for the sharpened elbows, or the adjusting, it's scary a little. And then after everything's calm and relaxing, it's ready to take a nap, right? Yeah. But awesome, thank you for the kind words. Regarding your actual condition, I'll just do a little. Oh, so was there something else you were going to say? It sounded like you were going to say something. I was just going to say, I also appreciated how you took the time to explain all of the things along the way too. So,
perfect. Okay,
that was really helpful.
Well, I'm glad. A big part of at least chiropractors who are educated in Canada, a big part of our curriculum is on patient education. And that's because we have studies that literally show that patients who are educated on their bodies, in whatever condition that is, they have a better prognosis, which is the term for how they do, as compared to patients who simply are never told, right? So if you are a healthcare provider, please educate your patients. Just tell them what's up. They're probably smarter than you give them credit for, okay? So explain in layman's terms. Yeah. To that end, between takes, I did actually explain in a little bit more detail about what is going on with your back here, Kat, and I'll just summarize that. The actual medical term would probably be like an L3, L4 interspinous ligament irritation or strain grade 2, because it's affecting the range of motion. That's a whole bunch of mumbo jumbo to say that she probably either sprained or irritated a small ligament between the spine of her back, okay? These things happen. You move. You're supposed to move. It's encouraged that you move. It's not something to stress out about. It does not mean that she should stop dancing.
Forever.
Never again. And you got to come in here 3 times a week for the rest of your life. Now, what I can advise is a short period of rest if it's still really irritating you, right? Try to maybe minimize the extension-based movements for now. We'll be able to get back to it, no problem, okay? And focus more on movements that encourage flexion of the spine, or instead of bending backward, bending forward. Things like if you were to do yoga, things like child's pose would be very, very good. But otherwise, you're going to be just fine. Okay, the adjusting can help in the short term. If things continue to persist a little longer, we could explore using needles or acupuncture to get in there and decrease inflammation as well. Yeah. But overall, very mild complaint, and it's not something to be stressed about. Okay. The upper back, the neck area, we wake up feeling weird all the time. If you don't have the right pillow, if you toss and turn all night, if you're particularly stressed, all of these things can happen. Again, it's not anything major or super concerning, just part of life. You can see a chiro, you can see a physio, you can see a massage therapist. They can all help you out. That's my tangent. That's my rant. You did great today. Thanks again for offering to come on camera here. Do you have any other questions, comments, concerns? Is there anything else that you would like to talk about for now, or?
How often do you recommend coming in to get?
That answer, like in a complaint like this, where it's not, you do not strike me as an acute pain patient, right? Like when you wake up, you can still go to work, okay? You can still walk the dog. You can still be a good partner, right? Like your pain isn't getting in the way of any of those things. So my answer to you would be however frequently you actually feel like you need to, rather than me dictate something strictly.
Right.
If you put that onus on me, I'd say, cool, I'll see you again next week, just once, okay? And check in with how you're doing. Are you getting better? Do you feel the same? Are you getting worse? And then from there, we can tweak. If you're feeling worse, okay, let's try the acupuncture. If you're feeling better, perfect, keep doing what you're doing. If you're feeling the same, okay, let's see you again next week one more time, see if anything else has changed. Here are some exercises you should do in the interim, right? So it's your call, all right? I would advise just checking in next week, making sure everything's going the way that it should be going according to what I think's going on. But there's no long treatment plan needed here. It's not a chronic condition. It's not something that should be overly stressed or overly treated.
Right, okay.
All right. Any other questions there?
None that come to mind.
Perfect.
I feel pretty good.
That's okay. Yeah. And if you do, you know how to reach me, so you can just message me. No problem. Thank you again for coming in, Kat. It was really great getting to know you. Take care.
Don't forget to like, comment, share, and subscribe.
Thank you so much, Kat.